Hello everyone, my name is Ayush Chinchani and today I am going to talk about the uses of big data in disease control. In this presentation, we will explore how big data helps in predicting, preventing, and managing the various diseases, ultimately saving the lives and improving the healthcare system. Introduction to big data. Let's start with the basic. Big data refers to extremely large and complex data set that exceed the processing capabilities of traditional data management tools. In healthcare, this encompasses millions of patient records, genomic sequence, and real-time monitoring data that requires advanced analytics to extract the meaningful insight. There are 5 V's of big data. First is volume, massive amount of data flowing from hospital, laboratories, medical devices, and research facility worldwide. Second is velocity. Velocity refers to the speed at which data is generated, like real-time patient monitoring. Third is variety. Variety means different type of data, like structured data, like electronic health records, and unstructured data, like social media posts or doctor notes. Fourth is veracity, which highlights the importance of data accuracy and reliability. And finally, value, because only proper analysis can convert the raw data into useful healthcare insight. In healthcare, the main purpose of big data is to identify the patterns, trends, and the correlations that can improve the patient care and help the control diseases. Importance in healthcare. Big data plays a crucial role in healthcare. Big data analytics revolutionize how healthcare system detect, respond to, and prevent the disease outbreak. By analyzing the patterns across millions of data points, healthcare providers can identify at-risk population before symptoms emerge, optimize the treatment protocols based on real-world evidence, and allocate the resource where they are needed most. The shift from reactive to proactive healthcare represent a fundamental transformation in disease management, enabling personalized interventions that considers the individual genetic profiles, lifestyle factors, and environmental conditions. There are different way that helps the data analytics in healthcare system. First is earlier disease detection that recognizes the outbreak patterns, anomalies before widespread transmission occurs. Second is enhanced diagnosis and treatment. Machine learning algorithms suggest optimal treatment plans based on similar patient outcomes. Third is cost reduction. Predictive analytics prevent expensive emergency intervention through early intervention. Fourth is personalized medicine, tailored treatment based on individual patient data, genetics, and response patterns. Now talk about wha- from where this big data are controlled. Talking about the source of big data in disease control. First is electronic health record that store the patient medical history and test result. Second is laboratory report that provide the test and diagnosis data. Third is wearable devices and sensor that track the heart rate, oxygen levels, and activity in real time. Fourth is social media and news feed that help to detect the early systems or decisions about the outbreaks. And fifth is finally the genomic data helps to identify the diseases at the genetic level. Together, this source forms a powerful network of information for the disease control. Now there are different types of big data analytics techniques. First is predictive analytics, forecast the disease spread patterns, identify the high risk geographic area, and predict the patient outcome based on historical trends and current condition. Second is machine learning model. This model analyzes the complex patterns across the millions of variables to predict the treatment response, disease progressions, and optimal intervention timing. Third is real time monitoring. It tracks the patient vitals, epidemic trends, and healthcare system capacity instantly, enabling the immediate response to changing condition. And fourth is data visualization. Interactive dashboards, geographic heat maps, trend graphs, it make the complex data accessible to the decision makers or the clients or the patients and the public health official. For example, a visual map can show regions with rise in malaria cases, allowing faster action. Now talking about the role in diseases surveillance. Disease surveillance system represent the front-line defense against epidemics, continuously monitoring the population for unusual health patterns that might signal an emerging outbreak. This sophisticated system analyzes the data from multiple sources simultaneously, creating a comprehensive picture of public health status. First is continuous monitoring, 24 by 7 surveillance of population health metrics across geographic regions and demographic groups. Second, early detection. Identify the unusual spikes in fever, cough, or other systems that may indicate disease clusters. Third is resource allocation. Enable the public health authorized to deploy personal, medicine, and equipment efficiently. Fourth is movement tracking. Analyzes the mobile location data to understand the population movement pattern during the outbreaks. For example, during COVID-19, the movement data help track the hotspot and control the spread of the infection. Role in outbreak prediction. Big data can even predict when and where a disease might occur. By analyzing the past record, weather condition, and population density, it can forecast outbreak like dengue. Governments can then issue early warnings and prepare hospital in advance. This predictive powers that the big data gives, it helps the save life and resources as much as possible. Role in disease prevention. Prevention is better than cure, and big data proves it. It helps identify the high risk population, like the people with weak immunity. It also suggests preventive action, such as targeted vaccination campaigns or public health awareness drive. For example, predicting the peak of flu season allow the hospital to stock vaccines early and prepare the better. Now talking about the challenges in big data disease control. First challenges we face that first is data quality issue. Noisy, incomplete and inconsistent data sets can significantly hamper the model reliability and then lead to incorrect prediction. Ensuring data accuracy requires robust validation protocols and standardized collection method across the diverse healthcare settings. Second is privacy and ethics. Personal health information require the strict protection to maintain the patient trust and comply with regulation. Balancing surveillance need with individual privacy rights present ongoing ethical dilemmas that require careful policy framework. And the third is infrastructure and expertise. Implementing big data system demands substantial investment in technology infrastructure, standardized data protocol, and interdisciplinary teams combining medical, statistical, and computational expertise to extract the meaningful insights. Now, talking about the case study of COVID-19 pandemic response in this how big data help. The COVID-19 pandemic demonstrate big data transformative power in disease control at a unscale. Health system worldwide leverage data analytics to track viral spread, optimize resource allocation, and inform the critical policy decision in real time. Tracking the virus spread, integrated with the mobile location data, test result, hospital admission, social media updates to map the transmission patterns across the community. That helps due to of because of big data. Second, vaccination monitoring, real time tracking of vaccine, thus administrated coverage rates by region, demographic gaps require targeted outreach. कहाँ आपकी आपको मॉनिटर करना कहाँ वैक्सीन लग गई है कहाँ नहीं लगी है एक रीजन वाइज सारी चीज़ें चेक करना, ये सब चीज़ों में भी आपको जो है वो बिग डेटा बहुत ज़्यादा हेल्प करता है। एंड थर्ड इज द कॉन्टैक्ट ट्रैकिंग एप्स, digital exposure notification system reduce the transmission by alerting individuals to potential virus exposure quickly. And fourth is the policy decisions. Government use predictive model to implement lockdowns, allocate medical equipment, and prepare the hospital capacity. This real-time data analysis during the COVID-19 demonstrate that how the rapid information sharing and coordinated response can save millions of lives during the global health emergency. And we can see that how in the major COVID-19 case, how this big data technology that help big data analytics help worldwide to check the vaccination monitoring, tracking the virus spread, contact the tracking apps, and policy decisions. Now, talking about the benefits of using a data, we have seen that the big data helps in disease control. Like we have seen that how it helps in COVID-19 pandemic situations. So this is all are the benefits of big data. Talking about some benefits of big data. First is early detection. Identify the diseases outbreaks in their earlier stages before they become widespread epidemics that are harder to contain. Second is better healthcare planning. Hospital and clinics can allocate the staff, beds, and equipment and medication efficiently based on predicted demand. Third is data driven decisions. Replace guesswork with evidence based strategies that reduce the medical errors and increase the treatment effectiveness. Fourth, faster emergency response. Enable the immediate coordinate actions during epidemics, pandemics, minimizing casualties, and healthcare system overload. This all benefits of big data. It's helped lot in disease control. First is early detection, second is better healthcare planning, third is data driven decisions, and fourth is the faster emergency response. Now, my dear friends, we have come to the end. So we come to the conclusions of this topic. Like first, big data is transforming disease control and healthcare globally, enables early detection, prevention, and effective treatment, helps government and hospital make faster data-driven decisions, and through ethical and responsible use of data, we can transform healthcare delivery, enable the early detection and prevention of diseases, empower government and hospital to make the faster evidence-based decisions, and ultimately the save millions of lives worldwide. Thank you.